I think she could talk about the sort of second order effects of how this had impacted her and her relationship and her guilt as a mother for not having looked after her child properly. And yet the fury that this had been at the behest of a doctor whom she trusted.
Hey everybody, how you doing? Welcome back to the Another Nobody podcast with me, your favorite nobody, Travis Myers. Today's guest is journalist Benjamin Ryan, who just wrote a great piece in the Free Press about the Fox Varian case. Now, if you're not familiar, the Fox Varian case is the case of a young 22-year-old woman who just won $2 million in a lawsuit against her psychologist, the guy who talked her into this madness, and the surgeon who actually gave her a double mastectomy at the age of 16. Now, I'm not going to bother going into all the details because that's why we have our good friend Ben here. So without any more nonsense from me, here's Ben. Hey there, Ben. How you doing, my friend?
Good. How are you?
Good. I'm so glad you're able to sit with me today.
Likewise.
And I know, a lot of this is happening so fast for you. You've been hit over the head by people wanting to do interviews, and thanks for joining me because this case just closed a couple of weeks ago.
Yeah, January 30th.
January 30th, right. And your piece came out in the Free Press. What was that, like February?
The following Monday. So the Friday that the case closed, Friday afternoon. Oh, the article came out Sunday night, the following Sunday. Yeah.
Right.
So people read it on the Monday.
Right. So you must have hustled to get it done.
Yeah. Well, I wrote a whole version of it before the trial, just in case, and we used almost none of that. And then I wrote another version, a week before he closed. And then as things were, and I was just praying, frankly, that she would win, because if not, I had a lot of work to do. So I banked correctly. No,
so you kind of thought that she was going to win from the giddy up.
Yeah. I'm really new. I've never sat in a court case before, so who's to know? But there was a lot of pretty damning testimony, I thought, about the psychologist in particular. The referral letter that he wrote for Fox Varian, his patient, was very sloppy. And it was really crucial that he had sent her to this nonprofit called the Pride Center in Albany, from the White Plains area up to Albany, which is like a 2-hour drive, because he said she needed more expert trans-related care than he was able to provide. And she only went there twice. But while she was there, she expressed to these people at the Pride Center greater ambivalence about her gender identity than she had expressed to other people, apparently to her therapist or her mother, and that she felt pressure to decide. She was embarrassed to tell her mother about that. And then the psychologist never got the notes from that session. And so the plastic surgeon said, had he known about this ambivalence, he wouldn't have done the surgery when he did. And I think that the plastic surgeon was much more willing to throw the psychologist Einhorn under the bus than vice versa. There were a couple times he said, if I only had known. For example, Fox Varian's estranged father had told the psychologist that he didn't consent to the surgery. And psychologist never told the plastic surgeon that either. And he said, if I had known that, I wouldn't have done the surgery until we reconciled the schism. So it really seemed that the psychologist was sinking pretty fast. Whereas I wasn't so sure about the plastic surgeon, because it just seemed like the burden on the plastic surgeon to clear the patient was less complicated. But it was a big debate about what was his responsibility. That was also unclear. His element, at least there was less material to go on. He only met with her twice, whereas Einhorn had seen her for 2.5 years. So there was just a lot more to talk about.
Okay, so you had seen her for that long. That was a question I was going to ask.
Yeah, they were a long-standing patient.
With a lot of these children, they're started, and I don't know where it began or if Einhorn was the guy that started her on this path, but quite often it starts literally at the first visit. You can talk.
Right, that's why they go there.
You talk to somebody for a half an hour, 45 minutes, and bang, the week you're on drugs,
It really varies. We've certainly heard that there are clinics in the U.S. that will prescribe gender transition drugs to minors after the first visit if they don't see any red flags. Reuters did this investigation in 2022, and they found a number of clinics that said that. But in Fox Varian's case, She was 15 and a half and had been seeing Einhorn for about a year and a half. When she first brought up the gender issue, she wanted to change her name to something androgynous. And then quickly afterwards, in this very short succession, she cut her hair. She changed her name again to something more masculine in her mind. She started coming out in public as transgender. And so that was the beginning of 2019 in January of that year. And she had her breast removed 11 months later. So the court case was really about that 11 months in particular. And I think the word rushed didn't come up a lot. I think that's the way people usually describe this. But it wasn't so much about the time as the content, I think, and the quality of the therapy that it pre provided. And frankly, I think what he was doing is he was providing the kind of affirmative therapy that everyone's pressuring all these care providers to provide. You're trans, okay, great. You want to have your breast removed, which she said she brought it up 2 months after coming out socially. And he's like, okay, we can work towards that. That was essentially what his notes were from that session. And so it was a real indictment, I think, of that larger ethos of being solely affirmative, because on the stand, everyone criticized this guy for not being more exploratory in the therapy
Right.
that it provided to her.
Well, I think something that you just mentioned, so our listeners understand too, is it was his affirmation of this thing, which although he had spoken to her, he had been counseling her for a year and a half, as you say, which again is news. I didn't realize he was with her so long. But as soon as she said, I may be transgendered, he was very affirming and positive about it, which again that's kind of the common thing these days, is it
That's
not?
supposed to be the norm. If you don't do that, people will accuse you of engaging in conversion therapy.
Right. Which is
So
is which is pretty tough because you've yet to done anything to be converted from.
I mean, conversion therapy, traditionally at least, is a very specific form of therapy that's usually coercive or forced upon somebody, or it's somebody who says, please cure me, doc.
Yes.
But they're like, the explicit goal of it is to eradicate homosexuality or
Correct.
transgender identity to you.
Yes.
Whereas the term has really been made much more diffuse by certain advocates in the transgender space to encompass anything that isn't purely affirmative. So if you just say, I'm transgender, like, well, let's consider that. Maybe not change your name today, but we're gonna talk about that. We'll put pronouns aside. We don't need them in the room since I'm talking to you. I don't use your pronouns to your face anyway. And let's explore this. That conversation, according to certain people in this field, is conversion therapy or de facto conversion therapy. And so, in theory, it creates a chilling effect in therapists who are afraid to do what this therapist, in fact, was found to be liable for malpractice for doing, which was not exploring this identity.
Now, do you have well, another thing, just so our listeners understand, you do not know Fox Varian or her mother or anybody personally.
Right.
I just wanted to make that point
No,
because
I not met
once we
them
start
before
talking, then
going into court.
correct, correct.
No. So
Mm,
I hadn't, some of these people you can interview them and they have press agents that are constantly emailing me, whereas Fox is very much looking not to be found.
she's a very private person, yes.
Yeah. And she said so when on the stand that she was unhappy that there were journalists documenting the case. And, that's the reality of going to court, is that is likely going to happen for something that's this much of a public concern, at least.
Right. So this case all began again when Einhorn decided that, she should go through with this therapy. From what I understand, I
I
just
mean, I
wanna
wouldn't put it that way, but he went along with what she wanted, essentially.
correct,
And
correct.
there was this idea that he was an enabler or giving tacit approval. And he ultimately wrote the referral letter in October of 2019 for the surgery.
Right. Well, and in many cases, when you have a doctor, he is in somewhat in charge of what you're doing, because he
Yeah,
he
I mean,
enables you, again, in this case, affirms your desires rather than, gives you better advice.
well, there was a big question, especially with children. She was being asked in the stand, did you look up to him? Did you see him as an authority figure? Yes, yes. And he actually said, under pressure from the plaintiff's attorney, Adam Deutsch, who was asking, is it important for you to choose your words carefully, especially with a minor? He said, yes, because especially with a young person, you can wind up essentially giving tacit approval. And he sort of sunk his own case with his own words. That ended up in the closing argument. And putting into words why what he had done was deviating from the standard of care per se, which is the big question. in a case like this, what is the standard of care? No one really wanted to say what it was because the second they would say it, they'd pin you on it, not doing it. And did you deviate from that? And did that deviation substantially cause the pain, suffering, and injury of the plaintiff? So the answer to those questions were yes in both cases, in multiple counts for both the plastic surgeon Simon Chen and the psychologist.
Right. Now here too, I wanna make sure I read it correctly. So, Fox Varian's mother, Claire Deacon, she testified to the fact that she testified that she was actually against the surgery, but she was convinced by Einhorn pushing the suicide narrative again, which is something that we've
Yeah.
heard again and again and again. Would you rather have a dead daughter or a
Mm,
trans son? You know?
yeah.
And that this is again I don't want to say the tactic, but I will use that word because I can't think of a better one. The tactic that he used in pressuring Fox's mother, Claire, into going along with this.
Well, I'm sure he really believed that, and that's the
Yeah.
narrative that you hear from a lot of the leaders in the trans medicine field is that these treatments, or in this case, the surgery, are used as primarily suicide prevention. But for one thing, there's only one study that actually assesses actual suicide deaths. It was conducted in Finland because they have all this great nationalized health data. And then they found out that giving hormones to young people was not associated with a difference in suicide death. And these outcomes are very rare as it is, even though they're somewhat higher in this population. But nevertheless, not associated with taking these hormones. And then when it came to the surgeries, so Dr. Lauren Schechter is the head of the gender affirming surgery program at Rush University Medical Center in Chicago. And he's also crucially the president elect of the World Professional Association for Transgender Health, or WPATH. And they really ruled the roost in the trans medicine field. They put out these guidelines, which everyone is supposed to use, and trans care. And he got up there and said that these surgeries in and of themselves are not suicide prevention. I don't use them for that purpose. And in fact, if somebody is suicidal, very, at great risk of suicide, that would be a contraindication for doing the surgery at that point anyway. So that
Correct.
really sunk that whole concept, which was really, it's been really studying for people to hear that from. Are you telling me that the guy from WPATH is the one saying that? I thought they were the ones who were pushing this in the first place. So that's really spun everything on its head since then.
Yes, yes, I could see that. Absolutely. Well, and since this has happened now, uh, literally, right after this case was over and right after your piece came out, not that it's any connection, although I'm sure it is,
No, I don't
both
think so. I think it's a coincidence.
the ASPCA, the American Society of Plastic Surgeons, has now decided that delaying gender-related surgeries should be delayed until the age of 19, okay?
These were deferred, which I thought was weird because it's suggesting that everyone would just wait as opposed to just not doing them under that age. It was I'm sure some lawyer came up with the word deferred. Uh, so we didn't say you're not going to get them. You just can't have it now. It's the classic tactic you use with a small child. Like we'll see. So, but
Well,
that was the word they used.
also, the only other large group to come out was the AMA, the American Medical Association, who also stated that gender interventions for minors should be delayed, again, delayed
These were
until
generally
adulthood.
delayed. So yeah, and that was strange because it was just in reaction to a question from the National Review. So that they, instead of just coming out with a statement, they just responded to somebody else asking them that. I don't know if they were preparing for it or what. But yeah, those were epochal moves, and also that the ASPS also cast doubt on the whether prescribing hormones and puberty blockers to minors represented a favorable balance of risk versus benefits, given the weakness of the evidence base and the severity of the potential impacts of the treatment. So it, they didn't say they were opposed to them, but they essentially cast doubt. So you'll constantly hear this, and the LGBT organizations, the ACLU, they're still saying it that all the medical organizations support these interventions, but that hasn't been true since the middle of 2024 when the ASPS said that they didn't endorse this in the first place and they were thinking about it.
Yes.
So I don't know what would ever take to actually get these groups to stop telling falsehoods about this, but they seem very determined to keep doing so.
Well, what I don't understand, and I don't know if you could even shed light on it, except for, your experience of studying it yourself, is the amount of fear, okay, that everybody suffers from saying something, from taking a
Hmm.
side,
Yeah.
from it's or from being canceled or
Yeah.
or losing funding, whatever it might be. We're talking about human beings. We're talking about children's lives. Again, for myself, and I know you're in the same boat as I am, at least I certainly believe you are, neither one of us have anything against transgenderism or transgender people as individuals. I could give a shit what anybody does with themselves. As an adult, we're talking about children, though, and minors. You know, quite often, as I've heard, as young as 3, which blows my mind that anybody would give drugs to a 3-year-old.
Okay,
But
let me
quite often,
correct you. No one
8,
is giving
10.
drugs to 3-year olds because you have to have hit puberty in order to qualify for any of them in the first place. So that's absolutely not happening.
But
But
the
they may socially transition a 3-year-old and, start dressing them or calling them the opposite
correct.
sex, et cetera. So that certainly happens. And that's something that was almost unheard of until in the United States until, 15 or 17 years ago. But that now is becoming much more common, and it makes it much harder to compare past research about whether these kids will stop identifying as trans as they get
Yes.
older. Part of the problem is also that the definition of the diagnosis that was used before 2013, it was also different, it had different categories and inclusion criteria. It's called gender identity disorder. So the old studies might have folded in a few more kids who were just seeing some gender related therapist because they were like little sissies, you might say.
Yes.
They're just like playing with dolls as much as thinking they were a girl, let's say, for a biological boy. So you hear a lot of poo pooing of that old research of like, oh, you can't trust it when it says it, like majority of them would desist. But also, you can't compare it because back then people didn't socially transition their children. And there, at least in theory, that can have a kind of a lock in effect or a snowballing effect. Similar as well as puberty blockers. Kids don't see puberty blockers as a time to think, as that's how they've been marketed in this world. They see them as an on ramp or a way station. I'm just like, okay, you want me to sit here and tread water till I get what I want? Okay, I'll do that if that's what's required of me. As opposed to like, now is a great time to reflect. So it's it's very hard to perceive what the counterfactuals are with these new methods because they're so new and because there isn't this other population that they're directly comparing them to that doesn't that doesn't isn't exposed to this larger culture that is very normal and expected of certain kids to transition when they're very young.
Correct. Right. I get exactly what you're saying. Exactly.
And that's not to say there's anything wrong with it, but in order to figure out if it's in the best of interest of the child, it's really hard to have some sort of comparison group.
Well, the tough thing, and of course, is being a father, being a grandfather now myself.
Hmm.
You know, um, our job is to tell our kids no. In general, your parents told you no, no, don't put your finger in a light socket. I'm not making
Hmm.
fun. I'm just in general,
Hmm.
don't you can't stay out too late. The government decides, you cannot smoke a cigarette until you're
Hmm.
18, or get a tattoo till you're 18, or drink a beer until you're 21. Why in the world would we allow this young woman here, Fox Varian, to, have her breasts removed at the age of 16
Well,
is a whole different world to me that
yeah.
I personally can't fit into my brain, if you will. So,
I mean, what I've noticed in reading books like Jack Turbin, he's this child psychiatrist at University of California, San Francisco, and he wrote this book called Free to Be. And listening to conferences and speeches from people in the pediatric gender world is they always phrase the attitude of the parent as one that inevitably, kind of like the arc of justice, arc of history bends towards justice. They have that same concept of like all parents will naturally get on board, and it's not even discussed that they could possibly say no, or that they say would assert themselves, say, I know my child better than you as this gender doctor, and I don't think this is in their best interest. That as an outcome isn't even mentioned. And I think by doing so, it's framed as wrong, as morally wrong. And so what's happened with this medical field, it's exceptionalized politically, it's been politicized, but it's also been melded with the civil rights movement. So
that's
it makes it so that you cannot say no without being considered a bad person. And especially if you live in a community where that is now the sudden social norm, then you have no one to turn to. You can't talk to your friends if you're ambivalent because there's this code. Even if they might think similar to you don't know that. So parents are very isolated. And I think, you hear all this, oh, they go on these evil anti-trans forums. Like, well, where else did you expect the parents who are ambivalent about this to find one another because they can't talk about it openly at school,
yes.
for fear
Yeah,
of being turned into an outcast? And
absolutely.
also for fear of having their child, essentially divorced from them and rupturing their family. So that's a huge risk. You see a lot in divorce cases, and this is true in the Fox Varian case. Even though she hadn't seen her father in years and he was highly estranged, he resurfaced and said that he was opposed to the surgery, whereas the mother was kind of quietly opposed, but she had been coerced, in her words or her description, into saying yes, and she did consent to it. But this often will play a huge role in divorce cases where one parent is opposed to it and the other is not. And it can really depend on the law of the state, uh, where not affirming your child. I actually can't remember if they passed this law, but at least was proposed in California, where a non-affirming status of a parent could be used, considered in a child custody case. So that could like count against a parent if they didn't affirm the child when
Yes.
deciding custody cases.
Well, they have even some very crazy laws out there. I don't know if you realize or are aware, there recently was a child who was taken, uh, Ukrainian immigrants of all things. They came here to flee the troubles in Ukraine, land in California. They're here for whatever 2, 3 years, and they end up having their child removed from them because they refuse to affirm him as him or her. I don't know what sex the child was, but they refused to affirm their child for whatever sex they chose to be, and the state took them away.
I mean, I've,
Which,
I've heard about this case, but I couldn't comment on it expertly. Just
right.
heard
Well,
mention.
neither could I. I'm just bringing it up because it happened to be the thing where the state, in my opinion, you know, is crossing some serious lines if you're removing children from their parents. I mean, you might as well do the same thing because you don't believe in agree with their religion, you know, or any number of ways that you're raising your child. It seems just bizarre to
I
me
mean,
that the state would go so
you
far.
could draw a parallel, like norms about spanking. Corporal punishment used to be the norm in our culture, and now we consider it to be abuse and cause for CPS to be involved. So, trying to look from the other side point of view, like they're setting a new cultural norm, and people are resistant to it, but it doesn't necessarily mean they're wrong just because it's new. Just
Right.
to play devil's advocate.
Well, I think a big problem that we have here with this situation as a whole is it's actually not a cultural norm. It's still such a tiny, tiny percentage,
Yeah,
and it's
but they
almost
they
like
dominate the
trying.
conversation in certain cultures, so,
Yes,
like
well, and
liberal environments.
they're trying very hard to make this happen. When I say they, the bunny ears they, where a very small population of the nation or the world, it's predominantly Western society, is trying to force something to happen that is not accepted by the majority of society. I'm sorry, go
Just
ahead.
like look at how the sausage is made. So GLAAD, which used to be called the Gays and Lesbians Allied Against Defamation, but now it's just called GLAAD. They're this longstanding LGBTQ group, and after gay marriage passed, they really pivoted to trans issues. So there's this guy named Nick Adams who's like their attack dog, who behind the scenes will try to get stories killed that are in media that they know coming up. So there was this big to do when in 2021, 60 Minutes was doing this episode segment about detransitioners, and GLAAD like went all out trying to get it killed. So that's one way behind the scenes. Not only are they trying to get like their language instilled in the style guides for whatever publications, but they're also trying to make it sure you don't hear from certain things that might undermine their goals.
Yes.
And that really makes you wonder if, like, well, if detransitioners exist, and we could at least frame it to say like these are more uncommon. However, these people also deserve to be heard from. It's very concerning to me that any media organization or media watchdog organization would just try to suppress truth at all like that. It's perfectly valid to suppress things that are wrong, incorrect, that are inflammatory, and phrase things in ways that will make people behave in irrational ways. But if you're just putting the truth out there like that, it's such an illiberal attack on free speech and journalism to have these organizations like this that are really controlling the narrative very effectively. And a lot of journalists are very scared of that. I had an editor tell me that she wouldn't run a very innocuous article I was proposing because she was afraid of GLAAD. She was afraid of losing her job. So they have a stranglehold on certain segment of the media, which is a real shame.
Well, here's something now too, is back to a prior conversation that you and I had about truth. Okay. Yourself as a journalist, myself as a detective, New York City police detective, we did not seek guilt. We seek truth, you know, and at all costs. And the idea that anyone would want to cover up truth. Okay.
Exactly.
Or any agenda. I don't care what your agenda is. Usually it tends to be political and or money. And in respects of GLAAD, who I don't know a lot about them, I know what their organization is and what they do, but it's now a multi-million dollar machine.
Yeah. They raise a
Okay.
lot of money. They do. But
Exactly. And
yeah.
the idea now that, you know, gay marriage, which was originally the main cause, has now been won, is the law of the land and universally accepted. I don't know anybody that really cares or worries about gay
Well,
marriage at all.
there's these weird little Christian groups that are like, actually, now we're going to come after gay marriage. And I'm just like, why?
Yes, exactly.
But,
But
yeah.
again, you're talking about a very small minority of people.
We'll see where the future goes, but in that issue, I don't know. But
Let's take a real quick break right now, and
yeah.
then we'll come right back because I want to ask you all about this case. We kind of went off on a
Okay.
couple of tangents there.
All right.
All right? 2 minutes, everybody. Hey, how you doing? It's me again, another nobody, Travis Myers. And today we're going to talk whiskey. I know most of you think of me as an all-American patriotic type guy, and you are right. But when it comes to whiskey and drinking whiskey, which I do, I always go for the Irish stuff. And my choice when it comes to the Irish stuff is Powers Irish Whiskey. Established back in 1791. It's a triple distilled, oak-aged whiskey. Powers is simply magic. It also happens to be the #1 selling whiskey in Ireland, which has got to say something, because if it's good enough for the Irish, it's good enough for you. So the next time you raise a glass, fill it with Powers, and think of me, another nobody, Travis Myers.
Hey, crime fans!
Join us October 9th through 11th at
Crime Story Fest
Crime Story Fest.
Crime Story Fest.
at the Doubletree Hilton on Boston's North Shore, Danvers, Massachusetts location.
Crime Story Fest. All things crime and mystery festival.
Come visit us at Crime Story Fest.
What else you got going on? What, you gonna watch another documentary on Netflix? Come on down to Crime Story Fest. Enjoy yourself. Have a good time. Meet some of your favorite podcasters, authors, experts. This October, Boston, be there.
One thing to note about GLAAD is that the New York Times, it's been a couple of years now, they put out this big investigation about Sarah Kate Ellis, GLAAD's CEO, who's, a very effective fundraiser, but she's also effective at spending the GLAAD's money. And they paid for the chandelier in her home office and soul renovation and paid for her Provincetown, like vacation home rental and like all of these first class flights to Davos and like fancy hotels. And it was really quite amazing. I mean, you look at this woman, like, she comes out like, the Emmys, they got some special Emmy, and she just comes out just looking like money. And I remember seeing her at the Emmys, and right afterwards, I think it was when that investigation came out, and I was just like, yeah, that's in keeping with my just general impression of what this woman is about. I mean, so glad, and you see like AMFAR, the American Foundation for AIDS Research, does this too. They really like to meld their identity with celebrity. Celebrity raises money. It gets eyeballs. So they have all these sort of celebrity ambassadors and all these fancy events with all these, fancy famous people on catwalks and separate repeats and all that. So, that's a way to raise money. But I think it can also get organizations to get their eye off the ball about what they're really there for. Are they there to be famous and, to be glamorous? Or are they there to work in the trenches and get stuff done for people who need it, whatever that might be?
Very good. Their purpose has changed quite a bit after this whole, trans phenomenon has taken place.
Yeah, well, I recommend there's a book by this guy named Ben Appel, and it's called Cis White Gay, and it's about his experience growing up in a Christian cult and then ultimately getting involved what he characterizes as the cult, which is the gender cult, and it's the way he sees it. And part of it had to be where he was a hairdresser in his 20s and had also gotten involved in AA after being an addict, and that turned into a cult. And there was like some AA segment and faction in DC that like was genuine, like run by a cult person or something. And then he was interning at GLAAD, and like that seemed like a cult. And you know essentially what he observed there was that being just a straight gay man, you're not queer, you're not genderqueer, you're not transsexual, you're not trans, you're not non-binary, was very stigmatized and looked down upon. And, they felt free to disparage him just
He
for
was
being a
he
straight up
was
gay man.
he was disparaged as being just a regular gay person.
Yeah, so that's why
Wasn't
he sort
interesting
of,
enough.
it's a very tongue in cheek, calls his book "Cis White Gay" because that's a slur essentially, and so it's kind of like that reclaiming a slur kind of action.
Right,
So
right.
I recommend that book to learn more about GLAAD's internal practices. But
But
it
we kinda
just really is a question of like GLAAD turning its back on its original mission. It's also a question of like, well, the gays seem fine, I guess, so we don't need them. So go help trans people. Okay, that's great, but in the process, you don't need to then turn right around and shit on the gays either. So
yes, which has happened
yeah,
considerably.
and there's just the way that some people see it. I think Andrew Sullivan, who's like the conservative British American columnist and now podcaster and Substacker, he's very uh, you know, outspoken about this idea of transing the gay away. And there's, there are gay men who I think are concerned looking back on their own childhoods. They're like, yeah, I was gender nonconforming and like play with Barbies. My friends are girls, would, go out and put like a towel on my head. Imagine I had long hair, 5 years old kind of thing. And those kind of normal affectations of a proto gay um, would be incorrectly routed per se into a trans identity. Next thing you know, you're medicalized and that's your life. And maybe you would have been happy that way, but I think it's very difficult for people to appreciate that saying that that's an undesirable outcome need not be because being trans is bad in any way, but because it's just harder to spend a whole life medicalizing, going through surgeries. Hilary Cass, the author of the British Cass Review, called them brutal surgeries. That's what came up in this court case. All of the ramifications and the numbness and the pain she went through, and that she had to have a revision surgery. That is a less desirable life just because it comes with all these risks. So
And then
if you
you're
can just be a gay man instead, that's just easier and less risky medically. So
well, and if you truly are a gay man, you are not a woman trapped in a man's body by any means. You know?
it's a larger philosophical question, and a lot of just the way of perceiving of it and rationalizing gender transition treatment is based in metaphysical concepts. And the Health and Human Services Department, at the behest of Trump earlier in 2024, wrote this massive report about pediatric gender medicine, and all the authors were Jesse Singal, the journalist, has said, and I agree that they are all very respectable intellectuals. But that said, you know, it was obvious how they would write the report. They were picked for that purpose. They were the most respectable people to find who would produce a report that would be very critical. Like, big surprise. But it had come out when the first edition of the report came out, before all the names of the authors were revealed later in the year last year, that one of the authors was Alex Byrne, who is this well-known philosopher from MIT, and he's written, gender critical book about transgender issues, et cetera. And everyone's like, what in God's name is a philosopher doing writing a medical report? First of all, they didn't read the report. And there's a whole
Well, they never do.
and I was just like, it is very logical that a medical field, which is grounded most centrally in metaphysical concepts, I am the other sex, that's a metaphysical claim, would require a philosopher. And they pilloried me for that. And one of the people who pilloried me was Florence Ashley, she's talking about everyone staying in their lane. Meanwhile, she's a law professor and like, I guess she's trained in bioethics, but meanwhile is constantly writing these papers about metaphysics and making these mystical claims about transgender identity. I'm like, that's literally you. Like, you're just projecting onto me or onto Alex Byrne that one should stay in their lane when, like, you're the one broadening your lane. You're the one she's the most prominent figure writing these papers to intellectualize these concepts that not affirming a child is conversion therapy. Those papers come from her.
Yes. Well, and it just goes to show the amount of hypocrisy that's involved in all of this. And especially back to when we're talking about GLAAD and these different organizations who are involved and the medicine, because I think this is a giant, giant money grab too, which is another topic we could talk about through medicine and creating lifelong patients. But so often, okay, those who, again, are throwing the most dirt are the ones who are projecting. They are every bit as much to blame as anybody else.
It's sort of not quite to answer your question, but there's this guy who's this infectious disease specialist who works in some Midwestern university, and he absolutely hates me. And it started because there's a sort of very like holier than thou woke medical professional who loves the verboten word list. And one of the words you cannot use is risk. You can't say to somebody, if you go out and have sex without a condom, you're putting yourself at risk of HIV. You're not allowed to say that because risk is stigmatizing and that's bad and all these things. And I was just like, well, how else would you like to say it? You could just say, therefore, you are at greater likelihood. Would you prefer likelihood? I mean, you're basically using a word that's a stand-in for a mathematical equation. So I don't know and he says, "Well, do you have any research to back up this claim that this word is so terrible and will scare away all your patients and make them have you drugs and well, God knows what else?" And he doesn't. But this exchange on Twitter just made him absolutely hate me. And she's just barnstorming about me. And he's gone around and like made sure various contacts that I used to interview in the because my history is I was an HIV specialist reporter until recently and kind of gotten out of it. Partly because these people blacklist me because they don't like that I won't subscribe to their Ranger games. But
Well, because they don't like the truth. In the end, they don't like the truth because it doesn't fit their
they
agenda.
also like to virtue signal. But a friend of mine said, Van, the thing about somebody like this is like the day to day life of an infectious disease doctor is probably extremely dull. And similarly, like a pediatric endocrinologist, eventually you're like, this is kind of boring. You're like, okay, you've got diabetes, and, it's a limited practice. There aren't that many kids, I suppose, that absolutely need you. But if you can expand your practice, not only to bring in more revenue, to be cynical about it, but also I think doctors that maybe are kind of bored with their practices, if they can add this civil rights element to what they're doing, it makes it feel like they have a cause. And if they're an activist about it, then they're an advocate, and then they go to conferences, and everyone wants to hear their name, and they write papers. And I think that's very exciting for people, and it gives them a sense of purpose. So I can really relate how that might make them feel special. It made it feel like they're really doing much more good than just sort of like keeping diabetic children from, going into diabetic shock or something. That it's just much more interesting. It makes their lives less dull.
Here now in this case, okay? So yes,
Hmm.
we were talking just to go back to what you mentioned before, virtue
Hmm.
signaling, which
Yeah.
people, at my age, it's a fairly new thing for me. At
Yeah.
20 years ago, I didn't even know what virtue signaling was, and now it's
Yeah, I
hitting
remember trying to
everybody
remember
by
that
default.
expression, and I was like, "What is that expression again?" And now yeah,
Exactly.
I learned that expression, like, around
But
2017, I think,
but
2015, 17, like, that
yes, sir.
era.
But my point here now, though,
Yeah.
is that individuals like this, and so many of these people in this field, okay, are now putting themselves in front of their patients. And this court
Yeah.
case in particular actually puts it on paper that it's true. Where, if this doctor, Dr. Einhorn, for instance, if he is, again, virtue signaling that he is doing right, even if he believes it, he's so into doing this good deed and patting himself on the back for it. And then Dr. Chin turns around and does the surgery because Dr. Einhorn says so. The victim here is Fox Varian.
I think one of those we're an expert in this field, like, he had seen us Einhorn had seen a small number of trans patients proportional to other ones, even though he said some of them with him for a long time, and similarly, Dr. Chin didn't do these surgeries very often.
Mhm.
Neither one of the are the types to go out there and broadcast that they're the good guys in this field or whatever. But I do think that both of them just sort of got the message from the culture at large in their respective fields that this is just how you do it. So, and plastic surgery, that it really raised the question of like plastic surgeons do have to screen out patients if they have body dysmorphic disorder. And we'll get
Sure.
into that, how that applied to this case in particular. There's certain people like, I don't think we're ever going to solve your problem. You really should see a psychologist about this. If you had one more nose job, your face is going to fall off or whatever. Um, so, but Dr. Chen, I think, just sort of saw this as a routine case and didn't see it as a need to do anything much more investigative than he did. And he was really proud of himself for having done 2 sessions with this girl. He thought that was going well above and beyond the call of duty. But crucially, the referral letter that Einhorn wrote for Fox Varian to Dr. Shen in October of 2019, he never put the correct diagnosis in there, which is gender dysphoria. He put body dysmorphia, which is a mental illness in which you
Yes.
have extreme ruminations about a perceived flaw, which oftentimes other people wouldn't even notice, feels like a freckle somewhere, whatever it might be. So there was always, it was never explained why he did that. Although in the deposition, he said he did it for insurance reasons, which makes even less sense because it's a contraindication for plastic surgery. So I don't know why an insurance company would cover it, although they did. But in any case, the plastic surgeon was really hounded by the plaintiff's attorney for not calling Dr. Chin and saying, why did you write this contraindication here? Like, what's going on? And if nothing else, not seeing that as a red flag that maybe this wasn't the most reliable psychologist, that he should seek a second opinion.
What gets me again, and we can talk about this in so many different angles, and we're talking about two grown men, two adults, two very well-educated doctors who think that it is the right idea to remove a 16-year-old girl's breasts, rather than saying, listen, dear, you have some problems. We understand this. We want to help you with your problems. Come talk to us when you're 21.
Yeah.
Come
Well,
talk to us
that's
when
just
you're 18.
become the norm.
It's
It was
shocking to me
surprising.
that this is the norm. This is
Yeah.
shocking to me.
There was such a push and pull, I think, really under the unsaid in this court case about what the standard of care was. And you couldn't just say, it wasn't a question of like, is it a wise thing to remove this girl's breasts? That was not on the table at all. Everyone said, like, we agree that for some youth that's acceptable and that it's beneficial. Everyone who testified said so. So outsiders such as yourself might say, well, that's insane. But just, at least in this court case, it was like, considering that, did you deviate from the standard of care for this particular patient, that this wasn't the right thing for her or for her at this time? There's a real question before the jury instructions were written and the jury was out of the room at this point. The lawyer was saying, I don't think we should have to prove that he shouldn't have done the surgery like the next week or the week after. The only question is, should he not have done the surgery on that day? Or should Einhorn not have written the referral letter on the day that he did? And so those were the, in fact, jury instructions. So it made it a lot simpler with having to create these alternative
Well,
scenarios in which she, okay, well, what if you did make her wait for 6 weeks or a year? Would she have changed her mind? You didn't have to imagine there would have been a different outcome. You're just saying on that day it shouldn't happen.
yes. Well, quite often, from what I understand, this is the first court case that you've done, but from a legal's perspective, they have to narrow it down as narrow
Yeah.
as possible to make
Yeah.
it fit into a legal category, whatever that is.
Yeah.
And so quite often, it seems like common sense may even go out the window because it is, look, we have to find, you were either guilty or not guilty of A, B, or C. And that's it.
Liable in this
That's
case.
it. It's liable, correct.
Yeah.
Because it is a civil action. But yes, and so it does become very narrow and sometimes take all of these questions are removed. So
Fox Varian is not a public figure. She hadn't said anything politically. There were no tweets of hers that were read out in court case, nothing like that. And there was only one mention of this idea of, is this the right thing to do for any kid? Neil Kornfeld, who was one of the defense attorneys for Dr. Einhorn, in his closing argument, he puts up what ultimately was kind of mocked as being corny, but the opposing side, this big slide of an elephant in a room, literally.
yes.
And, so there's an elephant in this room, and I was not allowed to be there for the voir dire for jury selection, so I didn't know about this until then. But he said, during jury selection, you recall there was somebody who said something to the effect of like, is this the right thing that we should do for kids? So he asked the jury to acknowledge that they may have personal attitudes about the wisdom of just doing this at all, and to try to just keep that in mind. I don't recall that he said to them, like, don't think that way, but that, we all have biases, so that's something you should consider as I thought that was a very fair point for anyone to make. Like, who are we kidding? We do have attitudes about that, but we're trying to separate them to do our best at being a jury. When I was in voir dire the last time, a few years ago, I never get picked. The judge says to me, like, can you tell me that you would be impartial, and decide this case purely on the merits with no personal biases? And I said, well, Judge, Your Honor, we're all human. We all have biases, and like, it's important to be aware of them. Some of them we're aware of, some of them we aren't. However, I can tell you that I would put those aside and do my very best to actually, even if it was against my other best principles, to decide it purely on the facts. She was just like, I need a yes or no answer. And I
Yeah.
was just like, "You're not gonna." She's like, "Get out of here!" Like
Right.
I'll never get picked because I'm too nuanced. You have to be a black or white thinker, I think, to be picked for a jury. They
Yes.
don't want anyone who says, "Well, on the other hand," I always tell people, if you want to get out of a jury, just say things like "nevertheless" or "however" or "moreover." Just say those words repeatedly. You're gone. Because they want yes or no, or else you have a hung jury.
So we're talking about juries now, and so here's an interesting fact. Now, so much of this trans stuff, as we know, hangs on politics. And I guess it is. It all comes down to politics. I can't think of another word for it. The trend that we've been going through for the last 20 years with wokeism and the virtue signaling thing and everything else. It is a type of politics, even if it isn't Democrat or Republican, right? But here we are in a county, Westchester County, okay, a very affluent county, a very, very left leaning county in New York State, okay, and yet they found for the plaintiff, okay, that these doctors were liable in harming her. Does that say anything to you?
I mean, I couldn't get any read on the jury whatsoever. And again, I wasn't there for jury selection, and I haven't spent any time in White Plains, so I really don't know the culture. I was just
Right.
just went there on the train from Manhattan, so it was just really hard to tell for me what the jury was thinking, except for that one woman was listening intently with her her chin rested on her thumb the entire time. So I knew she would be the fourth person, and she was. And another woman, her hair on her face was wanted to fall asleep the whole time. So. Um, Again, like the politics being stripped from the case, it made it a lot cleaner where I don't think those issues really had to come into play quite as
Well, they never
much.
should. Never do. And I would think that this, as the first big case of its kind, okay, is being in as left-leaning a county as Westchester County, as left-leaning a city as White Plains, New York, okay, that it is an excellent test case of what will happen in the future.
We'll see. I mean, before the case, and I talked to lawyers, and they say, medical malpractice cases are really unpredictable. And they said, if they lose this case, it's not going to be the biggest deal for us. These are like lawyers who do this type of litigation, defending or litigating on behalf of detransitioners. But if there were a series of losses, that would be pretty bad for them. But like just one loss wouldn't be a big deal. But they said if it's a win, it's a much bigger deal for us because that really sort of like sets the tone. So I think to your point, yeah, because it was also in a liberal area, but also this case doesn't compare well to a lot of the other ones because a lot of those other plaintiffs are really political. Chloe Cole is the most famous one, and
Yeah,
she's just made a whole
she's
career
gonna be
of
the
it.
next big one, right? What's she
So
gonna be in
yeah,
April, I
then the
think?
next big one is I'm going to get the name wrong, but it's in I can't remember the name off the top of my head, but it's in Nebraska, and I think it's January of next year. And then April, like the first week of April in 2027, is Chloe Cole's in California. So that's against Kaiser Permanente.
I thought
Yeah,
it
next
I thought it
year.
was this year.
I mean, that's going to be a bonanza. Everyone's going to be there for that one, and we'll see how long it lasts. But I can very well imagine that Chloe's very public profile is going to come into this, and that she's going to be accused of being an opportunist. That whereas it was very difficult and very sensitive for any of the defendant's attorneys to like go after this young woman on the stand in the Varian case. Sabrina Sellers is the other defense attorney for Dr. Einhorn. The first thing she said when she was doing cross examination of Fox Varian was, I'm probably not your favorite person right now. This sort of apologetic thing. And she kind of did this throat clearing of like, I'm a mom and this kind of
Yeah,
stuff, which didn't go over well. Fox was rather petulant through much of this. And
yeah.
it's really sassy to some of the questions. So
How was she
uh,
as a character? Did you like Fox?
she was very petulant.
I don't know if that's fair to ask, but it does sound like she had a spine.
Yeah, I mean, she certainly didn't crumble at all, and she was real sassy to some of these questions. And I think at first it worked in her favor, but after a while, it might have just come across as a little rude. Um, but I don't think that her testimony was as valuable or as pivotal as her mother's. Because her mother's was, I think she could talk about the sort of second order effects of how this had impacted her and her relationship and her guilt as a mother for not having looked after her child properly.
Yes.
And yet the fury that this had been at the behest of a doctor whom she trusted. So that push and pull with her, I think, was very relatable. And I said in other interviews that one of the most relatable things about the mother's interview was she was really frank about her ambivalence about her own kid. Her kid drove her crazy, and she drove her kid crazy. And there was, this description of, boy, your daughter was very angry with you that period. She said so in this context. Oh, she said, I'm sure she was. What daughter isn't furious with her mother and wants to go off and leave? And
Yes.
and so that type of honesty, really brutal honesty, they're like, oh, I can relate to that. It made her even more believable in the parts that were really crucial, where her describing disputed exchanges between her and Einhorn. Einhorn denied that he had coerced her, and she gave these very vivid descriptions of the scenes in which he did, in her words. So that, I think, seemed really credible. Whereas Einhorn was constantly faulting his own memory, and he was blaming, his sloppy notes or the sloppy letter on his poor verbal acuity. He would say, like, I'm not a verbal thinker. He said some version of that 2 or 3 times at least. And I
Yes.
thought that was a very strange, that's like, well, that's not an excuse, that's an explanation, And what you're saying is that your inadequacy has not only gotten you sued, but it has harmed this girl's body. And it was very strange to me. I don't know if that was something that he had discussed in advance of the trial to use, with his lawyers. That he discussed that this idea. Well, I'm not a verbal thinker, as you'll see. I'm just like, that's the worst defense strategy I can think of, because
Yes.
it just means like you're saying you're inadequate for your own job, and that this has put someone's body in peril. I was totally amazed by that.
Yes. Yeah. No, everything that I've read, it seemed like he did not do himself any favors whatsoever. You know.
No, and he sat there miserable throughout the entire trial. Chen didn't attend the entire trial. He was there for less than half of it. I kind of came in and out and seemed very imperious most of it. Although, once the plaintiff's expert witness, the plastic surgery, the Dr. Schachter came in and was just lambasting him. His demeanor changed, Dr. Chen. And I was watching him very carefully, and his right foot was trembling, so he was tapping up and down really fast, the sort of nervous habits. Whereas Dr. Einhorn was just spent a lot of the time, his face was sort of red and stricken, and he was just kind of looking down at the back of the chair in front of him, and just being ritually humiliated day in and day out. Even if he's not financially responsible, his insurance company pays the bill at the end of this. It was pretty devastating to watch a man be confronted with his own mistakes. There are times in anyone's life where you do something, you make a mistake, and you pay a price for it, and it's embarrassing for a little while, but like, you don't have to sit there for 3 weeks and be told day in, day out what you did wrong.
Well,
It's just,
that or if he does indeed feel any guilt, the idea that
we,
this young woman,
yeah.
has been mutilated and will never be whole again. So
He never, I don't think it ever would have been in his favor to say how he felt about, the
no, of
outcome of her
course,
body. But he did say explicitly, he said, I know that they're very angry with me and the mother and the daughter. He said something to the fact that that was very difficult. And I said, I've had various therapists over the years, and my previous one I saw 850 times. So if I cannot even imagine like that, if I had to like confront my ex therapist on the stand, like the pain for both of us to go through a schism like that,
right.
it would be worse than what I would if that happened between me and a family member. For that's how intimate a relationship like I had with that person. So I can only imagine like if you spent at the end, it was like, I think 3.5 years that he treated her. Um, so it's, hundreds of sessions, or at
Sure.
least, well over 100 sessions. Like that would be extremely painful. And in addition to just this idea, this is your career and your livelihood and what you've thrown your life into, and to have it go awry would be pretty devastating, I think. And I think that beyond the reputational damage, beyond, if it affects your premium of your malpractice insurance or something, I think that emotional suffering on the behalf of the professional, it would be a deterrent to, I get, maybe being overly affirmative and under exploratory in this type of therapy for certain. That nobody, it's a very different case between a surgeon being sued for malpractice and a mental health professional because the surgeon doesn't know their patients like mental,
Well,
and it's,
now with this surgeon Chin, you said that
he
the
met her, he saw her twice and then operated on her and saw her a few times for aftercare, and
that the prosecution surgeon lambasted him. What exactly did he get?
yeah,
Or other
plaintiff's
than
attorney.
removing her
You keep
bracket?
using the criminal court lingo.
Oh, I'm sorry.
Yes, the expert witness spared no expense in criticizing Dr. Chin for deviating from the standard of care, and he used words like shocking,
Yes.
that he didn't just see the for a letter as a stop sign. So, and Dr. Chin, you know, they always sort of read everyone's experience and their schooling. So, Dr. Chen, is it true that you went to Harvard, college? Yes. So he graduated the top 10% of his class at Harvard College and Vanderbilt University Medical Center, NYU, University of Washington, like all the best fellowships and residency, all the most competitive, all this training. So this guy was top notch. He had this real sleek suit on, like he just looked like money.
Mhm.
And so and my father is a surgeon, so and he had very similar training, and he went to Harvard medical school for his residency, blah, 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 went to Duke. And so I was just imagining like my father being reduced in this way. Like it was unimaginable to me because they behave like titans. They're playing God, and that's what they're doing with their everyday lives, so to speak. It was kind of fascinating to watch something like that be cut down to size, and by a peer, by somebody with an equally impressive CD, who was the head of a major program at major university medical centers. That was pretty fascinating to watch, but it didn't seem to phase him, you know, as it did Einhorn, where he was just like Einhorn was kind of crushed by it. Whereas I think that Chen just seemed a little reduced, and
Right.
supposed to like devastated.
Let
At
me
least
ask.
that's the way he didn't betray any like
I got a
big
couple
emotions.
of things I'd like to ask
Yeah,
you before you leave us here. Um, One for yourself, okay? Going through this case, did and I know you've written about this before. I know you know about this subject, but did any of it change your outlook? Did you learn anything?
yeah, yeah. I mean, I've written so much about the suicide concept, and I was the only reporter to cover the Finnish study that showed they didn't find that there was a connection between gender transition drugs and suicide death. So, and so many doctors you hear about saying, would you rather have a live son or a dead daughter, and all of that stuff. And, all of these advocacy groups are constantly pushing this as life saving care. The ACLU, even despite the fact that Chase Strangio, their leading trans litigator, said before the Supreme Court that there isn't data to support this concept that these prevent suicide deaths, the ACLU still runs around and calls it life saving care. So, you hear this day in, day out, but you don't hear a mother describing how that impacted her life, her child's life, their relationship, and her child's body. So the testimony of the mother to that effect, I found really devastating. But I guess it's in a way emboldened me to keep telling these stories because I'll get accused of being a bigot and an transphobe and all that kind of thing, or even covering these subjects. People, very clearly said on Twitter that they would prefer that I don't cover. No one covered this trial at all. That it was wrong of me to highlight these cases, which they believe are rare and are hogging the attention and therefore robbing kids of the care that they need. So, and I think that's an argument that should be heard, and that's worthwhile because there is a chance that some of these treatments are good for people, and if we move the pendulum too far, then it'll harm other kids. So I'm not there to make that decision. That's not my call to make, but I do defend strongly the importance of hearing the stories of people like this, who have been harmed and who take the stand very bravely, in my opinion, to tell a story about what the mother made clear she felt also was her own failing. I failed to protect my kid, but this person coerced me. And I think that story, some people might hear that and go, give me a break. Like you're an adult. You could have said no to this guy. But when you hear how it went down, and all the pressure she was under, you can see how that could happen to anyone essentially, and how it did
Absolutely.
happen in this case.
Here we're talking about a single mother at the time, I believe, right?
Yeah,
Well,
and she has a new husband, or I don't know when they were married, but it's
but who wants nothing in the world, as all parents do, but the best for her child. and she's got so many things that she's got to deal with this child, and now this on top of it. I mean, her head is spinning. Her head is, head.
Like, that's the way
I've
she
had.
described it, yeah.
Luckily, my kids are grown now, but I've had 2
Mhm.
teenagers, and your head is spinning wanting to do the right thing, you know? And then to have a doctor say, "Would you rather have, a live transgendered son or a dead daughter?" I mean, how do you deal with that? And some people are simply weaker than others.
Yeah.
That's all
I
there is.
remember, like, I was, I depressed as a really depressed as a teenager. I remember I think I was, like, 15 or something, and my pediatrician said to my mother when I was out of the room, like, "Well, what if you send him to boarding school?" And my mother, like, burst into tears. She's described this later, and, like, even that was, like, that suggestion, it's not like he would decide that I would go to boarding school, but even having someone, like, put their oar in like that was, like, almost too much for her to bear. So I can't even imagine. I My mother is long dead, but, like, I know how she would feel about this field. I'm not gonna say what she would think, but that's something that's kind of a moral compass that I hold, is, like, I know exactly what my mother would have thought. 'Cause she was a teacher and, was very good with kids and just was very intuitive about human relations and psychology, and the type of person anyone would sort of, like, suddenly confess their soul to on the bus, you know? Not that she took the bus because she was a very fancy person, but I think about that a lot of, like, if everyone's accusing me of sort of going awry with covering this up, I'm like, I know what my mother would think, and I know she would think what I was doing was right.
Good, good man. My last question for you now is kind of based around the same thing, and, my last question, unless I have to ask you something after this, but, how much backlash have you gotten from this article?
Oh god, this one, it's hard. Oh, I mean, there's this constant backlash. I guess I was a bit surprised there wasn't more there. The thread that they always say is like, you start to move rightward and you write for conservative publications, and invariably you're writing for Barry Weiss. They love to demonize Barry Weiss. But they're doing that a little bit. It wasn't as much as I thought. Oh, of course you went on CBS. I'm like, yeah, I did. She's running that network. So I'm gonna take advantage to go on television, talk about my work, wouldn't you? So it's just the usual. So it's
There's
nothing that I
nothing new
haven't
for you
seen.
then. No, nothing new for
I
you.
mean, it's been so I first started kind of tweeting about it at the end of 2023, getting curious about it. And what happened was I'd rather not say the a very big publication. I was going to write an article about trans stuff for them. It would be my first one. And I was sending out this email about it to various sources, just looking for information. And then this trans activist, Alejandro Caraballo, got the email, screenshot it, put it on Twitter, and said, this publication is working on this anti-trans hit piece by Ben Ryan. Nobody should talk to him. And my phone number was like right there at the bottom of the email. So I got all these harassing phone calls and stuff. And that got like 2 million views.
Yeah.
It changed my life overnight because it made me into sort of the bad guy. All of a sudden you feel like you're sort of standing naked in the cold. Shortly afterwards, the child of a family friend tried to get me kicked out of her mother's book party, for making her trans friends unsafe. Things like that started to happen. I look over my shoulder at certain places where I am, and you get these constant harassing emails. But eventually, I think hardly it kind of hits this homeostasis where if they realize the activists that they haven't scared you off, they pull back a little bit because it's not worth it.
Well, they get bored with you.
Yeah, but there's a big full court press to try to scare you off at the beginning, and they realize they can't do anything. They kind of pull their punches a little, just like wait for a good moment to get you to mess up or whatever. So, but it's just a part of my life, and it doesn't affect my personal life too often. But there certainly are times where that and other things that I've written have been really controversial, where people have, there have been schisms, let's just say. So, but I guess it's the price you pay. My side of the street is clean as far as I'm concerned. It's a shame because usually the people who do, draw some line with me and like swear me off, like they, I don't think they've read what I've written, and it's never a discussion.
They never read it, my friend.
You hear it a lot online. I say, "Well, read my stuff," and they're like, "I wouldn't deign to read your stuff." So I rest my case, Your Honor. Like, this person doesn't know what the hell he's talking about. You're just you're like you're repeating the party line, and I'm just like, I can't take that seriously.
No.
So and
They
so
never read it, they never do the research, they never
yeah, but
whenever
And
I
it's never they don't like come to have a conversation like what's going on with you or why are you doing this and it's never that. It's like it's a big sort of even if no one knows about it, it's sort of virtue signaling moment where they swear you off and it's like, well, good for you.
well,
And
what's so sad about it though is that they themselves, and again, we're putting, this bucket of people, you know, but they have no curiosity themselves. How do you not want to know what the truth is?
well, then you'd end up ambivalent and then you'd have to question your own positions.
I have been wrong so many times in my life, but I don't mind being wrong if I learn, you know? And if you tell me, "Hey, Travis, I think you might be wrong about this," I'm gonna look it up. I'm gonna read up on it, and maybe we can have it. Maybe we can get together and talk about it. You know, but they don't want to do that. They don't want to. They don't
Also,
want to learn. They don't want to know.
a lot of the people when they're discussing this and a lot of the experts, the doctors in this field, they don't distinguish when they're talking about children or adults. They just use the word like people or patients or trans people. And I'm like, I'm sorry, but there is a big ethical difference, morally, legally, ethically between treating a child and treating an adult. And 18 is an arbitrary line. You don't suddenly become get all your wherewithal overnight. But nevertheless, we've generally chosen that, or the Trump administration's chosen 19. But you have to it you can't look me in the face and tell me that the ethics aren't different with deciding to put a 9-year-old on puberty blockers that in all likelihood will lead them to taking cross-sex hormones and doing that with the 30-year-old who's been wrestling with this for 8
It's a whole
years,
different world. It's a whole different world.
And, it's become a norm in certain cultures say, "Oh, yeah, they should have their breasts removed," after a few months of discussing it,
Yes,
so that was just drove me crazy.
my friend. Well, I'm glad to hear that you're not discouraged at all. I hope you keep doing the
No,
work that you're doing. You're doing
thanks.
tremendous work.
Thank
Again,
you.
you're fighting a good fight for truth, and that's
Yeah,
the important thing right there. Is the truth.
thanks.
All right, to get the politics out of it, the nonsense out of it, the virtue signaling out of it. It's all about the truth, and I thank you for that, my friend.
Thanks, Travis.
So, well, unless you got something else, where can everybody reach you? Tell everybody where they can
Oh,
find you.
yeah. My Substack is benryan.substack.com. My website's benryan.net. And on X and on Blue Sky, it's Ben Ryan Writer.
Very good. Thank you so much, Ben. I really
Thanks a
appreciate
lot.
it. All the best, my friend.
Cheers.
All right. There you have it. Ben Ryan, everybody. Please, let me encourage you to check out his work at the Free Press and on his Substack. Now, I hate to think that I have to give disclaimers at all. I do not. These are serious conversations. I know this is the fourth one that I've had on this show in the last 12 months or so. If you go back to episode 24, was the first with Jamie Reed. That's a great interview. Please go back and listen to that. If you haven't heard it yet, go check out episode 24 with Jamie Reed. After her, I had another great talk with Jamie Michelle, which was episode 43. Please go back and check that one out too. Also, just 2 weeks ago, we spoke with Lauren Leggieri. All right. Great talk with her. This is an issue that I think a lot of people just aren't really hip to. They think they understand it. They think they know about it. All of us that have been talking about this, in this particular case, the 5 of us on this program, absolutely have nothing against trans people whatsoever. All right? So don't think that. Okay? This is not about disliking any individuals. What we do not like, what we do not believe in, what we think is absolutely criminal, okay, is the medical mutilation and chemical mutilation of perfectly healthy children. And that's what this fight is about. Okay? Please understand that. And that's all I got for you this week. Okay? So, until next week, my friends, please do the right thing. Hit that like button. Hit that subscribe button. We really, really like it when you subscribe. Hit the subscribe button. And that's it. Until next week, my friends, all the best. This is a 2024 American Eagle gold coin, which I bought along with several others last year. I'm very happy to report that its value has gone up over 40% in the first year. See, I was encouraged to buy some gold by a financial advisor friend who suggested I be more diversified with my investments. She said gold and silver was a very safe place to park some money, as well as a good hedge against inflation. So I took her advice, and all I can say is I wish I had bought more, as it's been so very, very good to us so far. Now, I purchased these gold coins from the good people over at stackingboise.com, who could not have been nicer, more knowledgeable, or more helpful. Now, I'm certainly no financial expert, but I will say from experience, if you're looking to make an investment, buy yourself some gold. And some real gold that you could hold in your hand, just like this coin you see here. And if you do, then do like I did and get with the good folks over at stackingboise.com. I'm telling you, they're good people, they took good care of me, and they'll take good care of you. Again, that's stackingboise.com. And hey, tell them Travis sent you. Hey there, true crime fans. Let me introduce you today to the Cold Case Initiative. The Cold Case Initiative is a foundation that donates money to smaller police agencies all over the country. It does this in order to offset the costs of scientific, forensic, and DNA testing with the hope of solving cold case homicides and other horrific violent crimes that otherwise would remain unsolved. Please, if you have it in your heart and a little money to spare, go to www.coldcaseinitiative.org. Again, that's www.coldcaseinitiative.org, and lend a hand where it truly is needed. Be a part of solving a cold case. Every little bit helps. Know that 100% of the donations that go to the Cold Case Initiative go to agencies that are desperately in need of the help. So please, if you can, do the right thing and make a donation. Thanks, and all the best, my friends.